want to do first is go to the top, cut right across the shoulders, because you're doing a coronal plane cut, or frontal plane cut. Go right across the shoulders of the top here, right through. Now, this particular vessel that you're seeing right here is continuous with the aorta, the very first artery coming off. It's called the brachiocephalic artery. That's it right there. Now, watch what we're going to do. We're going to come in here like this, y'all. Go across the top, just like this. And then we're going to go down the shoulders on the side, just like this, toward the apex. All I'm doing is making my mark right now. I'm making my mark because the second part of that first paragraph tells you what to do on this. Do it just like it says. If you don't, then you're going to mess yourself up. Now, I'm going to go on in here now. Since I got my mark made, I know I can cut it and get it right. Cut right through. I know where my mark is. And I'm going to cut right through it, just like this. Now, the heart is a rather tough, rubbery muscle. And you're going to see that. And I'm going to go ahead and get this part cut through, down at the apex. It's going to fall right open, like this. And now that I've finished doing my cutting, I want to go ahead and clean up my blade. I want to go ahead and clean this up so I can close the blade. Because the reason after I get through cutting that I want to close the blade, I don't want to leave it open. Why? Somebody could get cut. You know, if you leave a blade open, you've got a danger. There's a risk. Cut down on the wrist. Unlock this lock. Pull it back down like this. And then when you get it closed down, you can wipe wherever some grease is on the handle. Now, if you get a little bit of grease in here like this, you can take your paper towel and get it out. I'll go back there, and we got some brushes. There's a little grease there. All right, we got some brushes back here. Take one of these brushes like this. Just take it like this. And just go like that, clean it up for the next folks. No big deal. Now it's nice. Now, just set it down right here. Not going to hurt a thing. Got a little grease on it. You know, it might have a little film of grease on it. That's all right. At least it ain't rusty. Not rusty. Now we're inside. Now we're inside. And since we're inside, we're looking inside to see what we can see. Now look at the reading on this thing. Let's read what it says. On that first paragraph tells you everything we've done on this heart. Look what it says. It says, then identify the posterior interventricular sulcus, which travels from the superior medial ventricular area to the inferior ventricular apex of the heart. After making a frontal plane dissection of the heart, it is easy to identify the largest chamber of the heart, the left ventricle. See the appropriate figure. Now you can easily recognize right chambers and valves from left chambers and valves. Folks, that first paragraph really tells you how to dissect the heart, doesn't it? And I've demonstrated how simple it is. And we don't, once we get inside, we don't even care whether we're looking at the front or the back section of it. All we want to do is find the biggest room in the house. Now, I'm going to ask someone to come up, and we're going to go to the biggest room in the house, the biggest chamber in the house. And who would like to come up and point to the biggest chamber in the house at both of those cuts? Anybody? Come up. Mr. Flores, would you like to try it?
No, thank you.
Yeah. Oh, really? Okay. Well, you're going to notice one thing. One of those chambers goes all the way to the apex. The other chamber doesn't. Now, you'll notice the drawings and the diagrams of the heart don't show that, do they? But what is the truth? The truth is, in a real heart, would anybody like to give it a shot? Are you ready? Anybody, come on.
What's the question?
Show the biggest chamber in the heart. What is the biggest chamber in the heart called?
The ventricle.
Yeah. Would you like to try it? Yeah. Point out the biggest chamber in the heart for us. That's it. That's it. You got it. Thank you. Now, wait. Don't leave yet. And I need to see you to get you on this roster now, right? I need to see you about that. This is the biggest chamber in the heart here. Now show it to me on the other cut. No. First, show me the right ventricle first on this cut. Show me the right ventricle. Where's the right ventricle? Show me the right ventricle on this cut. Where's the right ventricle? That's it. You've got it. It goes all the way from here to here, doesn't it? Now show me the left ventricle on this cut. On this cut. Come on in where you can get to it. Show me the left ventricle on that cut. Where? The ventricle. It's got to be where it's right in here. See how it goes to the apex? See how it goes to the apex here? The left ventricle? Now, thanks. Now let me do this. And it'll make it, it'll make it show up better. Now, check this out, y'all. Here's the left ventricle right here, y'all. See it? Can you see the left ventricle here on this one? Left ventricle here. Here, can you see the right ventricle in here? Can you see the right ventricle in here? Does everybody see it okay now? What I had to do was I had to pick this part up a little bit, get it up to where you could see it better. See, here's the right ventricle here. See, it doesn't go down to the apex, does it? It's small. Everything in it is small. Even the tricuspid valve and the chordae tendineae are small. Even the papillary muscles are small in the right ventricle. The left ventricle has the biggest papillary muscles. It has the biggest thickest chordae tendineae cords. It has the biggest valve cusp, the mitral or bicuspid valve. And do you see where I'm coming from on that now, y'all? How simple that makes it? Look at this. Right ventricle, right ventricle. Left ventricle, see how big it is? Goes down to the apex, left ventricle. Look at this great big old papillary muscle right here. See this big old papillary muscle right here I'm pulling up on? Right there? Folks, that papillary muscle is big. Mute. Well done. Have you ever milked a goat? Have you? You never milked? Anybody here ever milked a goat? Okay, I milk cows, which have bigger nipples than goats do. But I've had students from the Caribbean and from Africa who've told me they'd milk goats. And that's why I had to ask. That's why I asked you. Well done. So, you came from the city, didn't you? Now, look at this. Here's the papillary muscle right here. It's about the size of a goat nipple, right there. Now, if you come in here to the right ventricle, let's see if we can find one in the right ventricle here. Look how small the one in the right ventricle is, y'all. It's a lot smaller, isn't it? It approaches closer to a human size. Now, the chordae tendineae for the papillary muscle in the left ventricle. And here are the chordae tendineae for the papillary, going to the papillary muscle from the tricuspid valve in the right ventricle. And here's the interventricular septum. Interventricular septum, right? Now, you can see where the valves are. In fact, one of the valves you can see right here very quickly is this one. From the left ventricle, this is a valve without strings going up through this. What do you think this valve is called? No, this is left ventricle, y'all. Is it the pulmonary trunk that serves the left ventricle? No, it's the aorta, isn't it? So this is the pulmonary semilunar valve, aortic semilunar valve. That's what that is. Then the blood goes out here and goes into the systemic circuit, right? Now you're going to say, well, what about, where's the semilunar valve for, and down through, out through the right ventricle. Now what we're going to have to do is take our knife again. We're going to turn it back over like this, and we're going to cut it. We're going to cut it right here so we can see the pulmonary trunk semilunar valve right here, folks. Right, and we'll cut it so we can split it apart. And we'll close this down. It's done. We're going to open this up now, just like this. And I'm going to take this out, let you look in here, like this. And I'm going to grab this semilunar valve in here. Hang on a second. Here it is. Here's part of it right there. I'm grabbing part of it right here. There's some more of it over here. Here's some of it. See where I'm grabbing that tissue right here? Where it broke, where I busted it? That is semilunar valve right here. This is semilunar valve. See it? See me tugging on it? Right there. That is the pulmonary trunk semilunar valve. And you can look at it too like that. Now I'm going to turn it back over so you can see the two halves. So once you get inside, folks, you don't care whether you got the anterior or posterior. You always go to, where do you always go? You always go to what? The biggest room in the house, which is this room here, this half of it, and there's the other half of it. What's the biggest room in the house called again? Thank you. I'm really pushing it in, aren't I? I want you to get the point. So, that's done. Now, we got that part done. I'll just leave that up there for you to look at. And I'm going to come over here now, and I want to...
The human heart is made up of 4 major chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs where it will become reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back out to the rest of the body through a complex network of arteries, arterioles, and capillaries. While blood is circulating through the body, it delivers oxygen and nutrients to tissue through the capillaries, and at the same time picks up carbon dioxide and other waste material. The veins return the deoxygenated blood to the right atrium, and the cycle begins again.